Now, the last part of the video on calcium homeostasis and the hormone regulating the plasma calcium that we are going to discuss here is calcitonin. Well, calcitonin is secreted by the parafollicular cells, often called as C cells, situated amongst the follicles in the butterfly-shaped thyroid gland. Recently, calcitonin has also been found in brain, prostate, and bronchial cells of lungs. However, the physiological role of calcitonin from non-thyroid tissues is not known. Well, calcitonin is a 32 amino acid peptide with a molecular weight of about 3,400 Daltons. Normal plasma level of calcitonin is 1 to 2 nanograms per deciliters and has a half-life of 5 to 10 minutes. Calcitonin plays an important role in blood calcium regulation. It decreases the blood calcium level, so you can say that it's counteracting parathermon as it decreases the blood calcium levels. So definitely, it is doing so in response to high levels of plasma calcium ions. Well, C cells that are actually secreting this calcitonin carry the same calcium receptor as parathyroid chief cells. So, like parathyroid hormone receptors, the calcitonin receptor is a G protein-coupled receptor that, depending on the target cell, may activate either adenylose cyclase or phospholipase C. Interesting. But calcitonin is not as important as is parathyroid hormone in the regulation of calcium metabolism. The two main target organs for calcitonin are bone and kidney. In kidneys, calcitonin inhibits the reabsorption of calcium and phosphate from renal tubule, hence excreting them as a result. However, these renal effects are of short duration and do not hold much importance. While on the bones, it acts primarily on osteoclasts, the bone-eating cells. What calcitonin do is that it inhibits these cells, and as a result, it prevents all stages of bone erosion. This prevents calcium and phosphate release into the blood, so their levels are lowered. Also, calcitonin stimulates osteoblastic activity, hence facilitates the deposition of calcium on bones and decreasing plasma calcium level. But do remember here that calcitonin is not essential for calcium regulation, and there are no clinical consequences of calcitonin deficiency or excess. Even the removal of the thyroid gland with its parafollicular cells at thyroidectomy causes no obvious problems with calcium homeostasis. However, calcitonin is used therapeutically to reduce pain associated with vertebral fractures and to treat Paget's disease, which is a condition of excessive bone resorption. So, that were the main hormones regulating calcium. But some other growth-promoting hormones, like growth hormone, thyroid hormones, and sex steroids, like testosterone in males and estradiol in females, tend to promote the incorporation of calcium into bones. Here, we have reached the end of the video on calcium homeostasis. For a quick recap, there are 3 principal hormones that regulate the calcium in blood. These are parathyroid hormone, vitamin D3, and calcitonin. Parathyroid hormone acts on its G protein-coupled receptors, increases plasma calcium by mobilizing it from bone. It also increases calcium reabsorption from the renal tubules and simultaneously decreases the reabsorption of phosphate ions. Not only this, but parathyroid hormone also increases the formation of 1,25-dihydroxycholecalciferol, that is, the activated form of vitamin D, 1,25-dihydroxycholecalciferol, increases calcium absorption from the intestine, and increases calcium reabsorption in the kidneys, and increases bone resorption. Calcitonin is synthesized and secreted by the parafollicular cells of the thyroid, inhibits bone resorption, and increases the amount of calcium in the urine, thus decreasing plasma calcium levels. So that's all. Hope you have enjoyed the video. Now, comment down below and provide your valuable feedback.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.